focus of our study was to define the postoperative ventricular changes associated with cone reconstruction of the tricuspid valve in Ebstein anomaly patients. We also sought to determine if we could detect any incremental benefit in a small group of patients who were treated with intramyocardial injections of autologously derived bone marrow stem cells during their tricuspid valve repair as a part of an FDA-monitored phase 1 safety trial. I am Dr. Patrick O'Leary, a pediatric cardiology consultant at the Mayo Clinic in Rochester, Minnesota. I am happy to have this opportunity to share the results of our recent research with you today. Our study will be published in an upcoming issue of the Mayo Clinic Proceedings and is titled Cone Reconstruction for Ebstein Anomaly, Ventricular Remodeling, and Preliminary Impact of Stem Cell Therapy. My colleague, Dr. Joseph Deraney, has demonstrated that tricuspid regurgitation can be successfully treated in most children and adults affected by Ebstein anomaly using the cone reconstruction technique. In contrast, our treatments for right ventricular myocardial dysfunction are very limited at present. To better define the standard ventricular response to cone reconstruction, we reviewed a retrospective cohort of 257 patients with Ebstein anomaly treated with that approach. We then compared this control group to 10 patients who also received additional therapy with autologous bone marrow-derived stem cells at the time of their tricuspid valve repair. We were not surprised to find that right ventricular size, as measured by indexed diastolic area, decreased in the control group, likely related to the elimination of their tricuspid regurgitation. Pre- and post-operative right ventricular function was assessed using the fractional area change technique. We found that both four-chamber and biplane right ventricular area change, referred to as FAC, followed a typical pattern after the valve repairs, decreasing immediately and then recovering slightly by the 6-month examination. Interestingly, the short axis RVFAC followed a different postoperative pattern, increasing both early and remaining improved at the 6-month exam after their surgery. We did not observe any significant change in postoperative left ventricular ejection fraction in the control group. However, by the 6-month exam, left ventricular end-diastolic volume index did increase relative to the patient's baseline, likely related to the previously mentioned decrease in overall right ventricular size. When the control group was compared to the patients who received stem cell therapy, we found no significant differences between the groups relating to the decrease in postoperative right ventricular size. However, we did observe augmented increases in both biplane and short axis right ventricular FAC values at the 6-month postoperative exam, suggesting an improvement in right ventricular function above and beyond what was associated with the standard surgery. Median values for the FAC assessment reached approximately 30%, representing a significant improvement relative to the preoperative short axis value and a return to baseline for the four-chamber value. Shifting to the left heart, left ventricular end-diastolic volume index did increase late postoperatively in the cell therapy patients, similar to what was seen in the controls. However, unlike the control group, we observed a progressive, although small, increase in left ventricular ejection fraction in the cell therapy group. Baseline LV ejection fraction increased to 65%, from a preoperative value of 59% in the treated patients at the 6-month exam. This increase was also clinically significant when compared to the 6-month value of only 56% observed in the control group. In summary, we observed that cone reconstruction was associated not only with the elimination of tricuspid regurgitation, but also led to a reduction in overall right ventricular size, an increase in left ventricular four-chamber volume, and small improvements in right ventricular myocardial performance as assessed by fractional area change within a 6-month period after surgery. Patients who were additionally treated with autologous bone marrow-derived stem cells showed no adverse effects during this phase 1 trial. Cell therapy was associated with an augmentation of the postoperative increase in RVFAC over 6 months relative to the historical control group. In addition, cell therapy patients had an unexpected improvement in left ventricular ejection fraction. We recognize that the retrospective nature of our control group limits to a degree the conclusions that we can draw from this study. Nonetheless, we feel that these findings are consistent with favorable right and left ventricular responses to cell therapy, and that this approach to treating myocardial dysfunction warrants additional evaluation, hopefully leading to improved methods of treating patients with complex congenital cardiac malformations and other disorders involving reduced ventricular function. Thank you for your time and interest in our study.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.